Today we're wrapping up heart attack, or MI, that myocardial infarction. So guys, just think, MI, the heart muscles die. Like all heart muscles, the heart needs oxygen to pump. And during a heart attack, there is a blockage in one or more of these oxygen tubes called the coronary arteries. And so the heart muscle suffocates to death. Over 500 cells die per minute. And if blocked over 45 minutes, these cells can die forever, called necrosis. So guys, minutes equals muscle. Now what causes this narrowing? Well, fatty deposits called plaque develops on the walls of the coronary arteries, narrowing the vessels, which makes it harder for oxygen to get to the heart muscle. So what causes this? Well, just like hypertension, we use the acronym SOTA. S for stress. This can cause momentary narrowing. So anxiety, cold temperatures, even physical exercise like sex. And stimulants like caffeine, even amphetamines like meth and Adderall, also narrows the arteries momentarily. But what really causes the most damage here are irritants found in smoking, which scars the arteries, and long-term obesity. Key term here, guys, a BMI over 25. But also diabetes and hypertension can cause stretching and tearing to the coronary arteries, which severely damages them. Coupled with a bad diet high in cholesterol from animal fats like meats and dairies can cause fatty buildup getting stuck in the cracks. And over time, this growth makes the blood vessels stiff and hard, something we call plaque. This plaque causes hardening and narrowing in the arteries, which is typically called atherosclerosis. So just think arteriosclerosis, hardening of the vessels from the scarring and plaque. Lastly, heart disease is more common in African American males and increased age over 50, and more common in men than women. Maybe women just handle stress better than men. I don't know. Eventually, too much plaque can turn into blockages, and if one of these plaques ruptured, usually from stress, a blood clot can form in minutes. And this blood clot can completely block all the oxygen to the heart muscle. Without oxygen, heart cells die within minutes, releasing proteins called troponin. And guys, this is the #1 indicator of an MI. But we're going to cover that in the diagnostics section. Now, narrowing is classified into 3 sections under the big umbrella of ischemic heart disease, meaning a disease of lower oxygen to the heart. And it comes in 3 sizes: small, medium, and large, kind of like a pizza. So for small, it's called coronary artery disease. Then stable angina, the stress-induced angina, or basically chest pain. Now medium is ACS, the acute coronary syndrome, which encompasses unstable angina and MI. Now unstable angina is our unsafe angina, which is unrelieved with rest and totally unpredictable. Far worse because it means we're closer to the larger condition of an MI, and then to death. So typically more pain experienced means more tissue death is occurring. Now, as far as signs and symptoms, any complaint of chest pain, guys, is super serious. Exams use the classic keywords of left substernal pain, but guys, now boards are getting way more advanced. So keywords like sudden or crushing pain, even radiating or shooting, and even, keyword here, heavy pressure, usually indicates a priority. So we'll see words for pain like substernal chest pain. Everyone knows that one. But here's a big tip: jaw pain, left arm pain, even mid-back or shoulder pain, and even, big one here, heartburn or epigastric pain. Coupled with SOB or shortness of breath, dyspnea, and even labored breathing. Now, nausea and vomiting and abdominal pain, not classic signs, but big for MI. Also sweating called diaphoresis, and even pale cold skin known as dusky, and even anxiety. Now here's a tricky thing. Diabetic patients can have something called a silent MI with no classic signs or symptoms. Guys, they have dead nerves from diabetic neuropathy, basically meaning they can't feel it. And even women commonly tough it out, thinking they're just tired or something. So typically MIs in diabetics and women often go unnoticed. Now as far as diagnostics for MI, both labs and imaging, any new chest pain always requires an EKG first. Big NCLEX tip. And no, you don't need to know how to read a 12-lead EKG for the NCLEX, or even the 5 other rhythms or views of an MI. But you do need to know for the NCLEX, ST elevation and ST depression. So ST elevation usually means no O2, or it could mean hyperkalemia, that high potassium. So we always confirm with troponin labs. So think if ST is high, then the heart muscles have died. And if ST is low, we always think low O2. Now this is called ST depression or T-wave inversion, again caused by that low O2, aka ischemia, meaning only partial blockage, or it could be from hypokalemia. And typically ST segments will go back to normal when we get reperfusion. So we confirm it with blood labs. Guys, write this down. Troponin is our #1 indicator for MI. It's our gold standard. So again, write it down. Troponin over 0.5 indicates trauma to the heart. As heart muscles die, this protein leaks out into the blood, along with potassium. So patients will also have high potassium, aka hyperkalemia. But our other labs like CK, CKMB, and even CRP, these are important, but guys, they're not commonly tested on the NCLEX. Now, a very common NCLEX question always shows an EKG with ST elevation or gives you a positive troponin over 0.5. Guys, this always indicates an MI. So we treat with drugs like Mona, but we're gonna cover that in a moment. But guys, the goal is always to unclog the oxygen tube within 45 minutes. So patients are taken to the cath lab immediately to locate and fix the blockages. We call it the ABCs of MI surgery. An angioplasty, aka PCI, is used to both visualize and move aside the blockages with either a balloon or stent. A bypass, also called CABG, to go around more severe blockages using a piece of vein or artery from another part of the body, usually the leg. Or we can just cut out the blockage called an endarterectomy. Now we can also use thrombolytics, aka clot busters, if surgery is not immediately available. Now these are called TPA or streptokinase, but they're usually not routinely given as first-line therapy, since they can cause massive bleeding. And usually they have to be given within 2 to 6 hours of initial MI. But we're going to cover these treatments in the treatment section. So now if troponin comes back negative, meaning no MI, we commonly do a different test to diagnose the narrowing here. This is called a stress test, where we stress out the heart, seeing how it responds with low oxygen. It's all done to help pinpoint potential blockages. So 2 types of stress tests are given, either an exercise or treadmill stress test, and non-exercise, called nuclear pharmacology. So exercise or treadmill stress test, we're looking for ST changes indicative of myocardial ischemia, basically low oxygen in the heart. So remember the 3 S's. During a stress test, we stop for chest pain or ST changes. Guys, big test tip right there. The NCLEX is going to ask for which immediate action by the nurse is of first priority. Now the answer is always to stop the test for ST changes or chest pain. Now as far as non-exercise nuclear stress tests, a radioactive dye tracer is injected into the vessels, acting kind of like a highlighter to help pinpoint potential blockages. Now a big test tip before chemical stress tests, guys, write this down. Huge NCLEX tips here. Since we're trying to diagnose narrowing, we teach the patient to avoid the meds and stimulants that can alter the test. Now 4 big key terms, always on Select All That Apply questions. We avoid the C's and avoid the T's. So 24 to 48 hours before, we're always going to avoid cigarettes and caffeine, including teas, sodas, and coffee. Guys, not even decaf. Even decaf contains small amounts of trace caffeine. And we're avoiding cardiac meds like nitro and beta blockers. These 2 can relax the heart too much and are going to alter the test. And lastly, guys, we're avoiding theophylline, the respiratory drug. This guy acts like a stimulant, causing narrowing. So write that down. Theophylline always comes up on exams here. Now, one last tidbit here, guys. There's no eating or drinking 4 hours before and after the test. We're not talking 12 here, so just NPO 4 hours before and after. Now for MI treatments, guys, again, think any acute chest pain, we always have to think heart attack. Basically, MI, the heart dies. Regardless if it's only a bad burrito or maybe it's just heartburn. The thing is, we don't know until we get an EKG and troponin. So guys, always think the worst. So right now, we give drugs to open up those oxygen tubes. Next, we remove the blockage, and after, we give the heart rest and prevent any future clots. Now you've heard the term MONA. But for the NCLEX, the correct sequence is oxygen for perfusion, aspirin, our antiplatelet conjugator, to prevent platelets from sticking together and forming a bigger clot. Nitro opens those coronary oxygen tubes to provide more oxygen to the heart muscle. And morphine helps the heart to relax, decreasing the workload. Now, all these drugs help get and conserve oxygen immediately. So big test tips for nitro: no Viagra, afil-ending drugs like sildenafil. Remember, afil will kill since both are potent vasodilators. It causes vascular collapse from low blood pressure. Now some other highly tested points here. Guys, 3 doses, a maximum of 5 minutes apart, no swallowing, always sublingual under the tongue. And headache and orthostatic hypotension are common, so guys, we take this drug while sitting to prevent fall risk. Now, a little side note, for chronic angina patients at home, we teach them to call 911 if there's pain 5 minutes after the first dose. Big NCLEX key term here, guys. Pain 5 minutes after the first dose. Now, test tips for morphine, guys. Any chest pain after morphine indicates an MI, even if it's only 1 or 2 out of 10. NCLEX key word here is chest pain or unrelieved pain after morphine. Typically, more pain equals more tissue death. Now, we fix the clot with cath lab and clot busters. So for cath lab, just think it clears the clot. Also called PCI, percutaneous coronary intervention. Key terms that show up on exams are arterial or even angioplasty. Now, angiographies or even angiograms are images taken via x-rays to visualize the blockage. And plasty means balloon or stent placement, requiring more recovery time. Patients are usually awake, not under general anesthesia. So before, we're NPO 6 to 12 hours, meaning no eating or drinking. And after, patients will lie flat for several hours and are encouraged to drink to dilute that contrast dye, which we'll be covering next. Now, bypass, also called open heart surgery, requires more recovery time, around 3 to 5 days in the hospital. So words including bypass like coronary artery bypass graft, or even MIDCAB, minimally invasive direct coronary artery bypass grafting. Usually a shorter recovery time because there's a smaller incision in between the ribs. Now, post-operative general rules here. We avoid lifting heavy objects and we protect incisions from infection. So big no-nos here, guys. No baths or soaking the wound, but a shower is okay if they avoid soaking the wound underwater. We want to prevent infection here, so we monitor for redness, warmth, swelling, and draining, specifically at the incision site. If there's any of these, then we report it to the HCP immediately. Now, test tips for cath lab. Guys, always think contrast kills the kidneys, usually used in procedures previously mentioned. So contrast dye, also called iodine, is a thick dye highlighter used to find blockages and narrowing. But it's really hard for the kidneys to wash it out of the blood. It's kind of like dumping cement into the washing machines of the body. So think thick dye, the kidneys will die. Now here are the top 7 test questions that come up with cath lab. Just remember the ABCs. A for allergy to iodine. And yes, warm flushing is normal. So guys, allergies to shellfish is actually not used as a tool anymore to screen for iodine allergies, according to the last NCLEX update. B is for bleeding at the catheter site. Direct or manual pressure on or above the site for any potential bleed. And patients will be lying flat hours after, aka supine. So NCLEX key terms here, guys, write these down. We're not putting the patient in semi-Fowlers and no crossing the legs. Also, no blood thinners within a 6-hour window. This means no heparin, no warfarin, aspirin, or even clopidogrel. Now, C is for creatinine, always indicating kidney function. Normally 0.9 to 1.2. So remember, contrast kills the kidneys, kind of like dumping that thick cement into a washing machine. So creatinine over 1.3 usually means an injured kidney, also called contrast nephropathy. So we avoid renal failure patients, and key word here, guys, write this down. Diabetics on metformin. We stop metformin 48 hours before and after the cath lab. We want to prevent lactic acidosis and nephropathy. And we can give Mucomyst to protect the kidneys, but it's not common on the NCLEX. So remember, iodine is like thick dye. The kidneys will die. Always a big NCLEX tip. Now the last C, you can't palpate the pedal pulse after surgery. Guys, we always call the doctor, aka HCP, healthcare provider. Remember this, pulses equals perfusion. Normally we get diminished pulses, but only 4 to 12 hours max, not 1 to 2 days. So NCLEX key words here, guys. Cold, cool, or remarkably cool legs, absent pulses or non-palpable, or even just present with a Doppler ultrasound. Big no-no, lack of perfusion. Now we can also give clot busters like TPA to dissolve the clot. So let's review the top tested content right here from our DVT video. Now fibrinolytics, aka clot busters, which are not routine for DVTs but are still used, these guys are like the atomic bomb. They're one-time push drugs. So we give either TPA or streptokinase. But guys, streptokinase has the most allergies associated with it. And the big thing with these atomic bombs is the huge bleeding risk. Since it has an 8-hour or less duration, this means we're most at risk to bleed during that 8-hour window. So guys, no injections at all, no new IVs, no sub-Qs even for diabetics, no IMs, and definitely no ABGs. These drugs can only be given through a compressible site like an IV. So we never give these through a central line because we can't hold pressure on that central line. Only peripheral lines here. Okay, now after the MI, we want to prevent clots and give the heart some rest. So heparin is used to stabilize unresolved clots and prevent the growth of current ones. Now big NCLEX keywords here, guys. Heparin does not dissolve clots. Only clot busters dissolve clots, like TPA. And to give the heart some rest, we use BCD drugs, beta blockers, calcium channel blockers, and dilators like nitro. So here are the big NCLEX test tips for pharmacology. Again, guys, we took over 10,000 NCLEX questions here, and here are the most tested keywords. Write these down. Again, heparin prevents clots by thinning the blood, so we have a huge bleed risk. So the therapeutic range for coagulation therapy is to keep the PTT between the ranges, guys, write these down, 46 to 70, always on the NCLEX. Typically a standard is 3 times max range. Now the antidote for heparin is protamine sulfate. So our memory trick is HEPIT, like a frog. Just think H for heparin is HEPIT for PTT and protamine sulfate. Now for all the NCLEX keywords and memory tricks for beta blockers, calcium channel blockers, and dilators like nitro, we include all that stuff in our pharmacology section. So we'll leave a link right here for the membership site. Now for complications after an MI, like a car crash, the heart has some pretty serious damage, specifically to the left ventricle, which happens to be the main pump giving oxygen and blood to the body. So when this guy fails, we end up with some deadly complications. So our 3 most deadliest complications here. Number 1 being cardiogenic shock. We're talking BP so low it's on the flow. So we watch for signs and symptoms of low cardiac output, being low blood pressure, agitation or confusion, cool and clammy, pale white skin, with low urine output, less than 30 mLs per hour. Guys, we need to increase that blood pressure fast with epi, dopamine, and norepi. Now, VFib and VTAC occurs in around 90% of recovering MI patients. Yes, that's correct, guys, 90%. Since the damaged heart sort of glitches or short circuits like a broken computer, slipping into deadly rhythms like VFib and VTAC. So remember, we always defibrillate if we don't have a pulse. And always early defibrillation before CPR if given a choice. Big NCLEX tip. We choose defib for VFib. And we also use cardioversion if you can count a pulse. And always remember to synchronize. Lastly, heart failure is a big issue, or pump failure we call it. Since we have a damaged pump, it fails to pump blood forward, and now it backs up into the lungs and/or body, eventually drowning the patient. So remember, HF in heart failure is HF for heavy fluid. Guys, always report these key words. Rapid weight gain, usually it means water gain. Worsening crackles can mean lung fluid, and even sudden edema or JVD. And even big keyword here, new S3 heart sounds or murmurs. NCLEX keywords like rapid, worsening, and sudden usually indicates a priority patient. Always the #1 intervention is pushing IV diuretics, like furosemide. Guys, they end in "ide", so think the body is dried. And a little side note, not isosorbide, that's a nitrate for chest pain. Lastly, 2 other conditions are common, pericarditis and mitral valve prolapse. In pericarditis, the inflammation to the sac around the heart can lead to deadly pericardial effusions, or cardiac tamponade. This is where the heart is basically squished to death by its own blood sac, causing the heart to stop beating. Very common on the NCLEX since it's very deadly. So guys, we always monitor for Beck's triad. So remember Beck. B for big jugular veins or jugular vein distension. E for extremely low BP. And C for you can't hear the heart sounds, also called muffled or distant heart sounds. Now with mitral valve prolapse, the little cords holding the valves can suddenly snap loose from a dead heart muscle. Now the patients will have a heart murmur and even develop atrial fibrillation from blood backing up, stretching out those atria. Now after an MI, we teach the 2 Ds, diet and lifestyle change, and drugs, or AKA pharmacology. Now it's not that we're just teaching them about diet and exercise. We're nursing a broken heart here. Now our goal here is to prevent heart failure. So the heart needs a few weeks off, with less pressure and less workload. Now we do this with low sodium and low fluid intake. So we educate the patient about the acronym DRESS. So say yes to the DRESS. Now D is for diet low in sodium and fluids. So remember the 2 and 2. 2 grams and 2 liters per day or less. This will reduce blood pressure and prevent heart failure. So we watch for heavy fluid. So we educate patients to take their own pulse. Guys, write that one down. Big key word there. We also do daily weights. Never weekly, but daily. And guys, any rapid weight gain or any new edema or worsening dyspnea, also called orthopnea, we call the doctor. These are early signs of heart failure. And finally, we teach the avoidance of high sodium foods like chips, dressings, ketchup, meats, cheeses, basically anything that comes in a package. Always remember here, sodium swells the body. And with heart failure, we're preventing heavy fluid. Now R is for reducing stress, alcohol, caffeine, and here's a big one, low cholesterol from animal fats. So avoid animal products like beef, poultry, and dairy products like cheese and creams. We're avoiding any and all land animals, but fish, that's okay. Now a side note again, the numbers you need to know for the NCLEX. All land animals increase bad cholesterol, like total cholesterol, triglycerides, and LDLs, the loser lipids. High cholesterol means high clogging, and these numbers love to show up on the NCLEX and exams, so guys, write these down. All these numbers should be low except HDLs, the happy lipids. The only ones that should be high, over 40. So HDLs help get rid of the bad cholesterol. And also eating fiber found in fruits and veggies can help clean out that cholesterol. So listen to your mama and eat those veggies. E is for exercise, 30 minutes, 5 days a week. This not only increases HDLs, those happy lipids, but also strengthens the weak heart. S is for smoking cessation. Big NCLEX key term there, guys. It prevents scarring, aka atherosclerosis. And another key term here, guys, is S for sex. That's correct, sex. It can only be resumed only after climbing 2 flights of stairs with no shortness of breath. Big key word right there. Now a little test tip about therapeutic communication after an MI. Most patients don't even see a need to change, but it's your responsibility as the healthcare provider to assess their fears, guys, by asking questions and teaching. So big keywords for the test. Avoid keywords like accusing, blaming, and even asking why. And speaking of things to avoid. So we teach patients to avoid NSAIDs like keywords here, guys, ibuprofen and naproxen, those non-steroidal anti-inflammatory drugs. These guys can cause an increased risk for thrombotic effects, aka a risk for clots. And this causes future MIs. Now speaking of drugs, we can always use the ACEs and ARBs to decrease the blood pressure. Now a lot of NCLEX questions come from pharmacology, and we do a full video for both ACEs and ARBs and all the other cardiac drugs in the pharmacology section. Okay, lastly, we can give 2 very particular drugs that prevent future MIs. Let's play that segment right here. So think AC for anti-clogging of the arteries. A is for antiplatelets like aspirin and clopidogrel, brand name Plavix. This guy prevents platelets from clumping together and forming clot. And C for cholesterol lowering drugs. Guys, these end in statin like lovastatin. So remember, stay clean because it cleans out the arteries, keeping them free from cholesterol. Now, since statins prevent the production of cholesterol in the liver, it is very liver toxic. So guys, don't give this to patients with liver problems like hepatitis or cirrhosis. Oh, and also avoid grapefruit juice since it blocks statin drugs. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos. Today we're wrapping up peripheral vascular disease, which is just scarring and narrowing of the peripheral blood vessels like those found in the arms and legs, making them really small and stiff and more difficult for blood to get through to the extremities. Now, peripheral vascular disease, also called peripheral vascular insufficiency, technically an umbrella term used to describe diseases affecting both the veins and the artery. Now, so many students get confused with this, so please listen close. Again, PVD stands for peripheral vascular disease, which affects both the blood vessels, veins, and arteries. Now, PVD is also short for a very specific disease called peripheral venous disease, also called peripheral venous insufficiency. It's a disease specific to the veins itself, where blood can't get back up to the heart. And on the other end, PAD refers to the narrowed arteries, where oxygen can't get down to the distal extremities like the fingers and the toes. Okay, so what's really going on in the body? Well, as you know, we have arteries and veins. Arteries pump oxygen away from the heart and out to the body. And veins act like vacuums, vacuuming blood back up to the heart into the vena cava. So remember, by thinking oxygen away to the body, and veins vacuum deoxygenated blood back to the heart. So veins naturally have lower pressure as they are vacuuming blood, and arteries naturally have higher pressure as they pump to the body. So narrow veins in peripheral venous disease means we have a problem vacuuming back to the heart. So we get blood pools in the legs, like a big old veiny pool party. Now, please write this down. This is not an oxygen problem since the arteries are working correctly. On the other side of things, PAD, that's the worst problem here, guys, because it is an oxygen problem. The narrowed arteries makes the pumping of oxygen A for away, A in the arteries, extremely hard. So there's no or low oxygen, which means ischemia, and then necrosis, tissue death. This is a way more severe condition than the oxygenated pool party of PVD. So PAD, think BAD. It's very bad. Low blood flow means low oxygen and low to no pulses, meaning we have cold legs that lack warmth. And also sharp calf pain when walking caused by the lack of oxygen. Guys, PAD is the worst. Now, as far as the signs and symptoms, PVD is the veins. So use the acronym VEINY, like a veiny arm. V for voluptuous pulses, meaning the blood is being pumped. Guys, the arteries are fine. The veins are the problem here. And that's why the legs are warm. So that's a huge test tip right here. Yes, we have pulses. This means oxygen is getting to the extremity. E stands for edema, where blood starts pooling. So guys, think of an oxygen pool party in PVD. I is for irregularly shaped sores. So think of this pool party as an exotic pool that has a weird shape, which is very different than the boring PAD that's just round and smooth. Now, N is for no sharp pain. Instead, we have dull pain. So no sharp pain during exercise because, guys, we don't have an oxygen problem. We have oxygen because we have pulses. Unlike PAD, where we have a very sharp pain from the lack of oxygen. And lastly, Y is for yellow and brown ankles. Big test tip right there is the ankles. Now, PAD is even worse, and everyone knows that. So PAD, think BAD because it's bad. Bad because we have low oxygen in the arteries. So use the acronym ARTS for artery. A is for absence of pulse and absence of hair, so we have shiny, cold legs. And imagine that, never having to shave those legs ever again. R is for round, red, smooth sores. Unlike those exotic pools in PVD with those weird shapes, in PAD we have red sores, also called rubor. So remember R for red. T is for toes and feet that are pale from the low oxygen. Or even in advanced stages, we get black toes called eschar. Big NCLEX tip right there. These black crispy feet are dead tissue. The toes have suffocated to death and usually have to be amputated, aka cut off. Now, S is for sharp pain in the calves when stressed, like during exercise or even elevation, like when sitting in a lazy boy chair recliner at night. This pain is the warning signs of low oxygen. And big test tip right here, guys, write this down. It's called intermittent claudication. This key word right here, intermittent claudication, comes up a lot on exams and the NCLEX, specifically for PAD. So guys, remember, intermittent claudication is intermittent cavication because it causes pain in the calf. And the emphasis is on the A for intermittent claudication because we remember PAD, so claudication for calvication. Now, why does this happen? Well, again, guys, exercise like walking up the stairs or even across a parking lot, the muscles are using more oxygen than while at rest. So the lack of oxygen causes this calf muscle pain. And when the legs are elevated, well, it's harder and harder to pump blood uphill, right? So again, low oxygen equals more pain. And now that you know the main testable differences between PVD and PAD, so what about the 6 Ps? You guys remember those 6 Ps the instructor always talks about? Well guys, the 6 Ps just assess the oxygenation of the limb. Usually always the lower limb, since it's harder for oxygen to get from the heart all the way down to the legs, right? Especially with the narrowing of the blood vessels from atherosclerosis, that plaque buildup like seen here. The lower the oxygen in the extremity, the worse the 6 Ps get. It's like your limb is being strangled to death, because this is exactly what happens when the body has no oxygen. It dies, also called necrosis. So write this down. The 2 most important Ps that will be on your test and usually always comes up in prioritization questions. Number 1 is pain, but guys, not any kind of pain. Unrelieved pain at rest. Big key word right there. When claudication is unrelieved at rest, this means PAD has moved into the most severe stages. And number 2 is paresthesia. Fancy words for tingling and numbness. It's like when your leg falls asleep, but guys, this is way more severe version. It's like the leg is holding its breath for a long time, or just being choked out. All right guys, a little side note for your future exams. These 2 Ps are always the priority and will always show up on CASCARE and even PAD. Guys, in both cases, we have an oxygenation problem leading to a loss of limb problem. So guys, we always think of the worst case scenarios here, which always revolve around oxygen problems. Really, any oxygen problem is an emergency problem and is always a priority. Guys, that's why the ABCs are always to prevent the loss of life. Airway, breathing, circulation. They always should be assessed first. Then loss of limb, then it goes into like risk factors and other stuff. Now the other 4 Ps, we sort of expect to be there, so we don't really focus on in terms of priority for tests. So we already know pulses are going to be diminished or weak, especially in PAD. And pallor is just the paleness from that low blood flow. We use the word polar, which the leg gets cold like a polar bear, since the leg lacks that warm blood flow. And lastly, paralysis, the inability to move the limb, like a paralyzed patient. Just think the limb is passed out from that lack of oxygen. All right guys, as far as treatments and nursing interventions, I'm sorry for jumping ahead right now, but guys, the biggest NCLEX and test tip I can give you in this lecture is right here. So guys, grab a pen, write this stuff down. Always, what makes the pain better? So guys, veins, we elevate the veins. So PVD and even DVT, you're gonna elevate. And arteries, you always hang. So PAD, put the arteries down. Now I can almost guarantee you this next part is gonna be on your exam. So PVD, guys, we elevate the legs. V is for elevate. All vein problems. Remember, elevating helps to vacuum all that fluid back up to the heart. So elevate, PVD, and even DVT. Now PAD, remember, put arteries down. A for hang the leg over the bed. Now the pain should stop and the color should return because oxygen is flowing now, down and away. So arteries pump oxygen away, right? And it's always harder to pump oxygen uphill. That's why we hang that leg. Now a little memory trick for your legs. This one's really fun. All right, so you have 2 legs, right? Like you have 2 fingers. Now, am I making a V or an A? Cool, I'm making a V. So are my legs up or down? They are up. So PVD and DVT, you guys put the legs up. Now if I turn it over for PAD, where are the legs? Well, they're down, right? So you always put the legs down to help the arteries push oxygen away for A. So guys, just do this finger trick during your test if you're having trouble on those confusing questions. PVD, you elevate, and PAD, you hang the legs. Now your teacher's probably gonna be looking at you funny and your classmates are gonna think you're weird, but trust me, you're gonna get the questions right. Okay, now the causes of vascular disease are anything that damages vessels, like smoking, which scars the lining of the blood vessels, uncontrolled diabetes, where the blood is turned into mud with all that sugar, tearing and stretching those blood vessels apart, and even high cholesterol, over 200. These little cholesterols stick to the vessel walls, making them stiff and hard. And lastly, even years of chronic high blood pressure, called hypertension, over 140/90. This adds so much stress and so much pressure, eventually stretching those blood vessels out, causing small tears in the vessels themselves.
Now, a big key term that you should know for your pathophysiology course: atherosclerosis, which I call atherosclerosis, the scarring and tearing of the blood vessels themselves. So the memory trick: Atherosclerosis is the hardening and narrowing of the blood vessels, limiting blood flow, that oxygen or O2 perfusion, mainly caused by fatty deposits called plaque that build up on the walls of the artery, narrowing the vessels, which makes it harder for oxygen to get to the end organs. So what causes this? Well, for the risk factors, think about the factors that scar the lining of the delicate blood vessels here. So non-modifiable risk factors are obviously age, gender, and genetics. These can be major risk factors to blood vessel integrity. Now, modifiable risk factors is obesity, a BMI over 25, sedentary lifestyle makes those vessels really stiff, smoking scars the blood vessels, and diabetes or diabetes mellitus, as well as hypertension, that high BP, and high stress. So just think about it here. The delicate little blood vessels get scarred from years and years of obesity or smoking, since the chemicals found in cigarettes actually scar the blood vessels, or years of high blood pressure, which stretches out and scars the blood vessels themselves. But really, one of the biggest risk factors here is diabetes, where clients have high blood sugar, very thick, syrupy blood. So just think the blood is turned to mud from all that sugar, especially with uncontrolled hyperglycemia, that high sugar. So years and years of very thick, very damaging high sugar, scraping and scarring those delicate blood vessels. So once the scarring and stretching occurs, there are small little areas where debris can get caught and filled in these areas. For example, lipids floating around inside the blood from cholesterol, causing fatty buildup inside the walls of the arteries. Also calcium deposits and even macrophages, those white blood cells, who come along and try to clean up debris, but they too get caught in these areas. So over time, this makes the blood vessel very stiff and hard, something called plaque. And this plaque causes hardening and narrowing of the arteries, eventually slowing or blocking oxygen-rich blood to the body. And this plaque can also burst, leading to blood clot. So a big patho tip here, be sure to write this down. It's a huge key point. Atheroma or plaque in the large arteries from accumulation of lipids, calcium, and possible clots, as well as a variable amount of fibrous connective tissue. So the main sites for this plaque buildup is the abdominal aorta, also known as the descending aorta, as well as the carotid arteries, the neck arteries, femoral arteries, and even the iliac arteries. So please be sure to pause the screen and write down these key points.
So to officially diagnose this vascular disorder, or even just to see how bad the disease has progressed, we can use a Doppler ultrasound that gives us an up-close and personal look on how narrow those vessels really are. Or a less accurate way of checking is an ABI, artery brachial index, which works only for PAD, that arterial problem. All we're trying to do is compare the blood pressure in the arm versus the leg. If the pressure in the leg is lower, well then something may be blocking that blood flow to the leg, meaning it's possibly PAD. And usually ABI blood pressures are done first, like in the ER or urgent care, before we do an ultrasound. Usually only done if a clot is expected. All right, now for the famous treatments. We always ask, what's the main patient outcome goal? Well guys, in this case, we have those very narrow blood vessels, right? So we want to open up those blood vessels like we're opening up a vein in TKO, to keep open. So in PVD, we want to keep those veins open, helping the veins vacuum more blood back to the heart so we can stop the pulling of blood, right? And in PAD, we want to push all that oxygen-rich blood away from the heart, down to the toes and extremities. So how do we do this? Well, we prevent the clogging of these vessels with some nifty drugs and surgeries. So think AC for anti-clogging of the arteries. A is for antiplatelets like aspirin and clopidogrel, brand name Plavix. This guy prevents platelets from clumping together and forming clot. And C for cholesterol lowering drugs. Guys, these end in statin like lovastatin. So remember, stay clean, because it cleans out the arteries, keeping them free from cholesterol. Now, since statins prevent the production of cholesterol in the liver, it is very liver toxic. So guys, don't give this to patients with liver problems like hepatitis or cirrhosis. Oh, and also avoid grapefruit juice since it blocks statin drugs. Lastly, if our AC anti-clogging drugs aren't working to do the full job, we can always do the ABCs of surgery to prevent the really big issue, a big clot in the blood vessel. So just like in the coronary arteries, we can do an A for angioplasty, where we put a balloon or stent to push aside that plaque and get more oxygen to the muscle. Or B, we can do a bypass to go around the plaque-filled arteries. And C, we can just cut out the fatty blockage called an endarterectomy. All right, guys, I said it once, but I'm going to say it again. The very biggest test topic is always positioning. Again, if you miss this on the test, it's not my fault because I tried to warn you. So guys, always PVD, we're elevating the legs to get that deoxygenated blood down to the heart. And PAD, you hang the legs to help oxygen move away from the body, right? Now, as far as safety, remember our little acronym SHT, like, oh, shiitake mushrooms. But I'm going to keep our little veiny and artery acronym in the corner there because it's super important. So our first S is for safety, which includes the 8 C's. What not to do. Guys, avoid these, please. Our first C is to be careful with hot temperatures. Guys, they have impaired feeling or impaired sensation, which means they're a huge risk for burning their skin and a huge risk for infection of that burned skin. Now, C is for caution with foot trauma, guys. Again, impaired feeling means injured feet can go unnoticed, leading to big wounds and, again, infections. And then, if the infection gets bad enough, amputation. So a good rule of thumb here is that diabetic patients and peripheral vascular patients, we're to treat their feet nearly the same. And this brings us to our main C, to avoid constriction. Guys, constriction of all kinds. We already have vessels with a narrowing problem. We don't need more constriction. So guys, big no on these guys. No crossing the legs, no constrictive clothing. That means no skinny jeans, no cigarettes, no caffeine, guys. And we're not only talking coffee, we're talking teas, sodas, chocolates, and even Red Bull energy drinks. And lastly, no cold temperatures, guys. That constricts the blood vessels. So guys, teach your patients to dress warm and bundle up before going out. Now our second S is for skin. We want to teach our patients to assess their skin daily. And the third S is for shoes that are well fitted. Huge NCLEX tip right there. For some reason, the feet are always well protected with diabetic patients and peripheral vascular patients. So a big rule of thumb is no sandals. Again, guys, we have impaired feeling, so we want to protect the feet from injury. If those feet are injured, that low circulation means low and slow repair and really long-term wound care. H is for hydration. That makes the blood less thick and less likely to get stuck pooling in the extremity. So basically, it's easy for those veins to vacuum it back and easier for the arteries to pump away. Okay, lastly, this final one, our T, always seems to be coming up on nursing exams. For some reason, the toenails. Toenails being trimmed only by the provider. Only by the doctor, the healthcare provider, the PA, the NP, whoever's taking care of the patient mainly. And this goes for diabetics too. Huge NCLEX tip, guys. Those toenails, I tell you, woohoo. All right, guys, now to wrap this up, the very last tidbit, not really an NCLEX tip or an exam tip, but patients can always limit their standing and even wear compression socks to limit their varicose vein.
All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos.